What is bioidentical hormone replacement therapy? The idea of something being bioidentical is the closest you could possibly get chemically or structurally to your natural hormones. A lot of the symptoms that are associated with kind of a hormone deficiency or a change in your hormones, whether it be estrogen or testosterone. When it comes to hormones, the hormone symptoms can cover a lot of other different types of disease processes and things that are going on. So if you are fatigued, tired, having insomnia issues, weight gain, specifically abdominal weight gain, loss in muscle mass, can't recover from the gym, low libido, and you're in that age range, say 35 to 55 in all reality, there's a chance that hormones could play a role. Most women, when coming in to talk to me about hormones, have a varying range of symptoms. My women in the perimenopausal range tend to come to me having a whole host of mild symptoms and just don't feel good and they don't know why. Your menopausal woman is pretty straightforward a lot of times. The vast majority of menopausal women have really low estrogen, and so that low estrogen causes hot flashes, low libido, fatigue, tiredness, insomnia. You've gotten to the point where now you're no longer having menses, your hormone levels are low, and we can raise those hormone levels and make you feel great. For bioidentical hormones, we utilize primarily pellets. Pellets are the hormone itself compacted into a small pellet that is generally about the size of a grain of rice. The pellet is placed underneath the skin, kind of in the fatty tissue on the upper portion of the buttock or hip kind of area. The dosing of the pellets is going to be based off of you as the individual. So the type of hormone that we use is going to be based off of your height, weight, activity level, your level of hormones, of course, and then the frequency in which we ultimately do the pelleting procedure. The two types of pellets that we use are estrogen and testosterone. Estrogen is important for somebody in the perimenopause or menopausal time frame. Testosterone we can utilize with or without estrogen, and testosterone can be used prior to the perimenopausal time frame. If you're not sure whether or not your symptoms are hormone related, the easiest thing honestly to do, come in, we get a full lab panel, run through all of your symptoms, run through your labs, and really try to figure out if this is truly hormone related.